Hello, Neil Baum from New Orleans, wanting to talk with you about conducting patient surveys. How to identify the needs and wants of your patients quickly, easily, and inexpensively. These are the needs and wants of urologists. I'm sure you are familiar with nearly every one of these components of needs and wants of urologists, but I would like to focus on the last one, how to monitor the doctor-patient encounter. I've used this slide before, which shows the 4 pillars of a successful practice. Today, I would like to focus on just one, and that is the patients that are already in your practice. What can you do to find out about their experience with you and your staff? There are 2 pathways to success. Simply, they find out what the patients want and give him or her more of it. And the second is to find out what the patient doesn't want and make every effort to avoid it. So how do you find out what the patients want? According to the good book, it's ask and you shall receive. You have to ask these patients about that experience. You can't just assume that everybody is having a stellar experience in your practice. I think of a patient survey as giving your practice a checkup. There are multiple ways to do this. There are personal interviews, focus groups, suggestion box, even a mystery shopper. But today I want to talk with you about conducting a patient survey. The easiest way, of course, is the suggestion box, and that is placing a box in the reception area and allow the patients to complete a form, place it in the box, and then it's really important to respond to all of their either compliments or suggestions. The way I do it in my practice is I have the patient provided with a card when they check in. The card allows them to answer 6 questions. It is very easy for them to do. It can be accomplished in just a minute or 2. And I find that this is a very easy and effective way of generating the responses of your patient. On the reverse side of that survey card is something that I found to be very useful and allows me to avoid the doorknob question. And that is, I encourage them to write out what 3 questions they would like to have answered on their visit today. And I ask them to complete that either in the reception area or the exam room. And I have that given to me when I am in the room with the patient. Some patients will fill out the card and ask for additional cards or have comments and suggestions that they post on the other side. And I go through this very, very quickly before concluding the doctor-patient encounter. And that way I am certain that I have answered all of their questions. An example of a suggestion that was given to me as a result of the survey, one of the patients complained that the use of wooden or wire coat hangers on the door of the exam room was making far too much noise, and they suggested using a padded coat hanger. This was easy to do and accomplish, and I happened to have agreed with them that it really was too noisy because other patients could hear the door make noise when it was open and close And this was easily solved with an inexpensive padded coat hanger. Well, we're in 2022, and the approach now is to use online surveys, and I recommend surveymonkey.com. It's a free service. It's very easy to use, and it will give you a handle on what your patients are experiencing in the practice. So these are some examples. You can create your own survey. They give you templates, but these were 5 of the questions that I used on the survey monkey.com. Also, on the survey, you can program it to answer all kinds of questions, very specific questions. This was a survey was done on telemedicine, and I point out that the majority of patients, well over 3/4 of the patients, were satisfied with virtual visits. So in summary, we need to listen to our patients. And the only way to really listen to them is to ask them how we can make an effort to provide them with better service. A patient survey is easy to do. It is easy to interpret it. And it also lets us know what we are doing well and what we need to do to improve. Well, I hope you found this brief video on conducting patient surveys helpful and useful. If you survey your patients or have any other suggestions regarding surveys, please let me hear from you at this email address shown on the last slide. Thank you.